2020 brought about many challenges to our workforce and to our patients. In these times of crisis, our staff revered the foundations of patient experience, such as safety, creativity, agility, connection, and compassion. We saw barriers rise throughout the system and amazing efforts from the staff to overcome them and to provide the high-quality, equitable, and compassionate care for our patients. We'd like to take a moment to highlight these amazing teams.
At Mount Sinai Brooklyn, we experienced challenges to providing compassionate care since our patients weren't allowed visitors and when staff were unable to enter the room as frequently as they wanted. This affected the patient experience because we value face-to-face interactions and connecting with our patients on a very personal level. To overcome this barrier, the staff would call the patients in their rooms to check on them, but also just to chat with them. This helped show compassion because our staff became the visitors our patients couldn't have and allowed the staff to build relationships even though they weren't in the same room.
The COVID-19 pandemic brought many challenges to the patient experience, including implementing visitor restrictions, which kept many of us safe, but also placed constraints on families' ability to say goodbye to their loved ones in person as they approached the end of life. This restriction also had a profound impact on the frontline teams who witnessed many patients dying alone. As such, a group of staff made up of physician assistants and rehab services rose to the occasion and became end-of-life companions. They sat bedside with patients holding their hands and helped families digitally connect to be present as their loved ones passed. Families were deeply appreciative of the service as it allowed for closure during a time of deep personal loss, and it also comforted the end-of-life companions and frontline staff, knowing they were able to do this for our patients and families during such a difficult time.
At Mount Sinai Beth Israel, one of our medicine residents had the creative idea to use baby monitors on the floor to allow nurses to see and speak to their patients more frequently without entering the room. The Coleman family and members of our community donated 23 monitors that went directly to the units that needed them. Not only did this help our nurses keep their patients safe, but it also gave them the opportunity to connect with and show compassion to their patients, even when they could not be in the room.
During the height of the pandemic last year, families weren't allowed to visit in the hospital. In March 2020, I had a patient on her 80s with COVID-19. She started telling me that this must be so tough on us and she appreciates all the help we've been giving her. She passed soon after and I wanted to write a letter to her family. I pitched the idea to our CNO, Jill, and she supported it. I wrote to the family and connected on how I connected with her and how she inspired me, thinking of us during those trying times. Even though she was scared of what was going on, I wanted the family to know that she was not just a number to us. We saw how she was as a person. Her family wrote us back and told us that we are her angels.
At the Ear Institute at New York Eye and Ear Infirmary of Mount Sinai, we see many patients who have hearing loss. Wearing masks makes it very difficult to communicate. Some of our patients have a significant hearing loss, which makes it almost impossible for them to understand what is being said. It can be extremely stressful for them. When I greet my patients with my clear mask in the waiting room, their face lights up and I can see it puts them at ease immediately. It makes us happy to see how something little we can do makes such a huge difference for our patients.
A shining example of a Mount Sinai Health Network practice that commits to compassionate care is Mount Sinai Jackson Heights in Queens. Due to masking and social distancing protocols, some of the humanness of face-to-face interaction had the potential to be lost. Mount Sinai Jackson Heights demonstrated agility by stationing a medical assistant in the lobby to assist with COVID screening and to be a friendly face upon entering the building. Upstairs in the waiting room, a greeter meets patients to assist with welcoming and wayfinding, provide assistance with check-in, and communicate wait times.
At Mount Sinai South Nassau, we anticipated that many members of the communities we serve, including seniors and those with mobility issues, might not be able to travel to the hospital to get their COVID vaccination. Tapping CARES Act funding, we partnered with the town of Hempstead to purchase and deploy the region's first mobile vaccination unit, known as the VaxMobile, to bring the vaccine directly to dozens of local villages within the town. So far, more than 1,000 residents have been reached, including many working people who simply didn't have the time to take off and were appreciative that this was so convenient. The VaxMobile and its dedicated staff have garnered significant media attention and have won high praise from elected and civic leaders.
At Mount Sinai Morningside, we wanted to take the opportunity to celebrate our discharged COVID-19 patients. We noticed the toll that COVID-19 deaths were taking on our staff, and we wanted to celebrate the patients who survived. Additionally, we wanted our discharged patients to feel our support, love, and well wishes. To address this challenge, we created the Pause and Applause program. Whenever we were notified that a COVID-19 patient was being discharged, we gathered in the lobby to applaud them as they left. This helped show compassion to our patients and also build teamwork between our staff as well.
This past year has been difficult for all of us. Restrictions were in place, social distancing became the new norm, but we didn't stop caring for each other. The Mount Sinai Hospital staff exemplified compassionate care to our patients and each other. For instance, when our patients weren't allowed visitors, our staff became their family. On the ICU, staff took creativity to the next level. As the barriers to connecting with patients increased, staff decided to use the whiteboards in the glass walls to write non-clinical fun facts about patients to share with each care team that interacted with each of those patients. This simple act of kindness showed that the patient that the staff were caring for were not just seeing a COVID patient, but a mother of 2 kids who loves her job. This compassionate interaction shined a light in the darkest of times, reminding us the importance of being better together. We continue to recognize our staff during this pandemic and celebrate them for their incredible dedication to the patient experience and providing exceptional care for our patients and each other.
Thank you to our teams around the system for reminding us of why we do what we do, because we want to make a difference and help people to care for them when they need us most. You all have shown us once again that we are truly better together.